started. Hello, everyone. Thanks for joining us. Good morning, good afternoon, wherever you guys are tuning in from. I have a number of folks that are here on Zoom, and shout out to my colleague and producer, Katie Source, who is also helping us to restream this on, let's see, I think we're on YouTube Live, we're on Facebook Live, and LinkedIn. So hello to everybody that's logging in and signing in live on all of those platforms. For those of you that are on Zoom, please feel free to drop questions in the chat. We'd love to try to answer them in real time as I go. I've got a single monitor right here, so I may not be able to just jump to the questions immediately as we're going through, but I'll try to keep an eye on those. Katie will try to funnel questions from the social media platforms over here onto the chat. For anybody, or especially if there's questions that are really narrow or related perhaps just to your particular situation, we'll try to answer those offline afterwards. So for all of you that are live joining us, welcome, we're glad you're here. And again, for everybody watching this on demand after this, again, thank you for tuning in. I think important to note that this is being recorded on September 14th, 2021. Though we're not really talking a lot about policy, the point of view and the opinions and the work that we've done is based on everything up to this point. So if you're watching this on demand in the future, understand that things may be changing in the time since we've actually developed these. So, and again, thank you to everybody that's joining us. It's a very diverse group as we looked at the registrations and the folks that signed on either live or on demand. Really diverse group of hospitals, larger health systems, smaller community-based organizations. There's associations, some folks joining us from there, and even a lot of nonprofit organizations as well. So very diverse group. And I think in spite of that, though, the trends that we'll share with you over the next, say, half hour, 40 minutes or so, are really relevant to all of those. I think you'll find something for all of these. Certainly, we talk a little bit about hospitals and health or in service lines and service line marketing a little bit, but that's not the main focus of what we'll talk about. So I think you'll find something for everyone. So again, thank you for tuning in. Please, throw questions at us throughout. Would love to try to make this as much of a dialogue as possible, in spite of the fact that it's really just a monologue. So welcome to the 2022 Healthcare Marketing Trends. I'm Paul Fahey. I'm your host and moderator, and going to take us through the next thing. So what I thought we'd do before we jump into the trends, thought it would be good to get us all into the same page. Really just maybe a recap of the highlights and themes over the last year, 18 months or so as we've been defining it. Would be good, I think, to get an understanding, at least as how we see it, of the new healthcare consumer. And with that in mind, I think that'll help sort of level set us as we go into this year. We have 7 trends. And again, please, questions and conversation throughout as we're going. Really want to give a significant shout out to Lisa and Katie for their help, not only authoring the trends report, but also producing this webinar, a lot of the outreach and the content that we share. It's really part of our mission. I mean, yes, we're a consultancy. We do derive income from the work that we do. But like you, I think we have a more noble view of this profession. So we're really happy to put content out there like this that's free, that we hope will help guide you over the coming years. You're building your teams, your budgets, looking at your priorities. So really want to thank Lisa Brown and Katie Source for their help putting all of this together. I'm happy to present their work and help share it with you, but really want to make sure that they get the credit where credit is due. So thank you both. And I'm not sure if you're tuning in, but hope you're here too. So. And a bit about our methodologies. I mean, certainly a lot of this is our point of view on the trends and the issues that we think are important to highlight, as well as some practical and actionable tips and things. But this is really based on work we've been doing that Smith & Jones has been doing since 2014. And it's really a lot of direct observation, consulting with really a client mix as diverse as the audience that I've described, but also direct email surveys that we've been doing. We spend a lot of time with very formal interviews, one-on-one interviews with many of you, recognize a lot of the names and faces in the audience. As healthcare marketers, we talk to a lot of association leaders, industry thought leaders, elected officials. There's really great content. American Hospital Association, CDC, SHISHMED, NESHCO, New England Society of Healthcare Marketers and Public Relations folks really produce a lot of great content, and a lot of that is what helps to inform our work. We think we're very adept at social listening. By that, I mean not only looking at our own social media, but the conversations, not just the posts that we put out, but the comments and conversations that it stimulates, not only for ourselves, but even for our clients as well. I think that's something that's important. And Google Trends, a very free service, fascinating service if you want to look at what's a public sentiment or a particular topic. Great example might just simply be bed bugs. We talked about this a lot 7 or 8 years ago, and it doesn't seem like anybody's paying attention to it anymore. And so when you type that in Google Trends, it's kind of fascinating to see that be a blip. Fidget spinners, all these kind of fads that sort of came and went. But more importantly, when you look at some of the service lines, the work that we're doing, consumer trends in healthcare, phrases like telemedicine or whatever, you can learn a lot from it. It's a bit of a rabbit hole. So if you're a data geek like us, block some time out. Once you start typing in phrases into Google Trends, sometimes it just gets away from you. So anyway, I think all of this is just direct observations, our direct research, as well as aggregating some of the third-party content that we either help produce or pay attention to ourselves. So happy to share that as part of our background. And again, as I mentioned, we've been doing this since 2014, highlighting a few covers here. Really just to kind of answer the question, how can marketing and PR and community relations help within your organization? So it's really tailored to those audiences, those professionals. We try to feature some very actionable tips and takeaways, but it was very important to us early on that we recognize that the sizes of teams vary. For those of you that subscribe to or get SHISHMED's, I think it's called the By the Numbers report. It starts to give advice on how an organization of your size compares to others surveyed across the country, and it starts to look at the types of functions, the size of the teams, the skill sets, the budgets, the type of media that they use. It's really a very fascinating report, so a shout out to them. But I think it's important to recognize that most often these marketing, PR, community relations teams are pretty lean. So none of this is designed or developed, assuming you've got $1 million budgets and 40-person teams, with that in mind. So we try to keep this as actionable and practical as possible. So a little bit of background on that. So look, as we make our way into the 2022 trends report, building over this last crazy 18 months or so, sorry to report that it's not over yet. But I think as we move into, or as we write this new COVID variant is flaring up. The impact that not only COVID's had, but a lot of other societal issues around us has really dramatically changed the healthcare landscape. I think, we looked at a lot of ways we tried to turn those hardships into opportunities over the year. We're looking at how we can move into new phases, but new challenges are going to arise with regard to how hospitals and health systems and healthcare organizations meet the needs of this new consumer and how we can adapt. And one thing I think that's pretty remarkable, and I'll try to highlight this as we go through, is I guess it's the old saying that never let a good crisis go to waste. I think it's attributed to Rahm Emanuel for my friends in listening from Chicago. But the point being that COVID really created an opportunity for disruption. It certainly changed how healthcare consumers are thinking, how they're processing information, how they're making decisions. And more importantly, I think it signaled the opportunity for a huge disruption on the landscape as we're moving forward. So we'll try to share that with you as we go through. And a shout out, I see someone from Chicago commenting in the chat, so at least on the Zoom. So thank you, and let me know offline if I'm actually attributing that quote appropriately to Rahm Emanuel. So again, sorry to say that it's not over, but we really think it's important that we share some of the insights that we've been gathering on how we can adapt to this as we move forward. So look, what's the situation? And again, we lived this. Many of you were on the front lines and lived this much more than we did. There was a very heroic response to COVID. You'll hear me say this probably repeatedly throughout this presentation, because I say that repeatedly throughout any given day. We really regard this as your 9/11 moment. And I mentioned that with this, anniversary pretty fresh in our minds over the past weekend. This opportunity or this situation over the last year and a half really shined a very bright light on your profession, much in the same way that the first responders in 9/11 did. And I think it put you and hopefully, giving you the credit that you deserve, among the public. But early on, we had a shutdown. We're certainly now in an economic downturn. And, depending on who you talk to, economists or the region that you're from, some economies in some regions are doing better than others. Certainly we're better off than we were in that initial downturn. Things really went off a cliff. March, April, stock market went down. Everything was literally in shutdown mode. But still, and I think as we look at the Delta variant, initially people deferred or just canceled elective procedures altogether. Certainly disruption in supply chain. We had community groups coming together to help, make PPE for us. Very, very dramatic rise in telemedicine. And I think that's something you'll hear us talk about throughout the presentation. Really this rise in telemedicine and how that finally can take its place appropriately, create some efficiencies, create opportunities for us to build sort of what we call digital relationships, but also with a bit of doubt and fear, what this is doing to the competition, empowering them to move a little bit faster. Historic levels of unemployment, which meant a rise in uninsured patients. Now, a lot of those benefits packages, the federal benefits packages came to an end a few weeks ago. And, hopefully the labor numbers will bear that out in the coming weeks and months that we can get folks back, on the payrolls. But that also changed not only that sense of, mental health regarding the routines that we had, the economic stability that we had, but also their ability to engage in the healthcare system. So as I mentioned before, and I'll say again, there was this quarantine consumer. There are permanent changes in behavior and decision-making that we'll talk about, and even the Delta variant itself. So what you'll hear, and for those of you that are downloaded or have already downloaded the Trends report, we believe that this hardship over the last 18 months has really sparked innovation. Folks have improved access through telemedicine like they never did before. We've seen not only caregivers embrace something that they were skeptical about, we've seen patients and the public really demanding and really having no alternative in some cases. Number of, what we're seeing even in New York State, low threshold access to buprenorphine for folks that are living, with lived experience with drugs. That rise in telemedicine to help support them to meet their needs has been really instrumental and a really, in my opinion, a very important trend that happened and accelerated through the pandemic. One great example of how that telemedicine can help a population that doesn't necessarily have traditional access or may not want to engage in face-to-face medicine. And that carries through, to a number of different audiences. The older generations, which we sometimes think of as being sort of technologically challenged, really embraced it. They had to consume these technologies to stay connected to their families. And so it was very easy for them to extend that into healthcare. Equality through better policies. I think one of the things you'll read throughout our report when you download it, or if you download it, we talk a lot about how the differences in the COVID infection rates by community also really highlighted the inequalities that are there within our communities. And you'll hear us talk about this later on. We see organizations investing in new ways of doing business as a result of this, deeper appreciation for our workforce, as I mentioned before, and really think, and again, you'll hear this as a highlight throughout, the importance that many of you placed on working to build that trust within your community, a trust regarding safety, and also compassion, and you'll hear us, talk a little bit more about that as we kind of go through. So consumers in quarantine early on was very severe, and obviously things have lessened in certain areas, but For our friends and clients in the Southeast in particular, Florida, Georgia, there are communities in there that are really back down to shutdown mode. So they've gone into the hole, into the bunker, and as I described here, they were focused much lower on Maslow's scale of needs, if you will, really only the essentials. They were focusing on just, groceries and the basics, and in some cases, and this is probably more relevant for a year ago, stockpiling. They really wanted stability in every place of their lives. Any sense of control that consumers could have, they would, which meant that they weren't switching brands only in response to supply problems. So if they couldn't buy a particular product or get a particular service, in our case, they would switch reluctantly, but they really wanted stability every place else that they could. Certainly an explosive growth in this sort of delivery, drive-through, drive-in, very digital delivery mode of all types of products and services. And you'll hear me talk about that a little bit. They were in a wait and see mode then, they're in a wait and see mode now. I think there's a lot of skepticism about the Delta variant. We're early on in cold and flu season and the numbers are creeping up. So will the vaccine help tamp it down, or are things going to spike like they did last fall, or even worse like they did last January? Let's wait and see. Consumers also learned they didn't need as much. They could do more with less. And this is probably more of a consumer retail sentiment, but it could apply to healthcare as well. Consumers got their entertainment elsewhere. For those of you not as familiar with this, retail shopping is entertainment. And if you're not going out and making a day of it, having lunch, going shopping with a friend or family member, you're going to consume that or do that elsewhere. So they just learned how to adapt in all aspects of their sort of consumerism. As I mentioned before, they embraced technology. They had to. I'm broadcasting from my completely empty kitchen, dining room, living room combination. Today's moving day, by the way. But they embraced technology for work and social aspects to stay connected with friends and family, but also, it became very easy and comfortable for them to move that into healthcare, into telemedicine. But they're leery of what's happening and what's coming. They're still feeling a bit off balance as they're going through. So meeting that new patient, kind of in summary of what I've just described, online information access is essential, both for diagnosis. They're looking at physician reviews, how they're making decisions. It's driven online more than it ever has. They're shopping for healthcare providers based on quality outcomes. They know that they're in a bit of a driver's seat with their ability to have options and choose. And again, we'll talk about this as we get into the specific trends. Consumers, these new patients, are getting provider recommendations from people that are in their social networks more than they ever have been. I wouldn't say in all cases that that's going to trump what they would get from their primary care physician, depending on the nature of what their situation is. But we're seeing not only an increased reliance on digital social media networks, asking for recommendations, asking for referrals, but also from their offline social networks. And in particular, this is true among younger patients. I think still, the conventional wisdom that older patients will make decisions based on proximity and out of habit probably still holds true, but in particular, those millennials, these younger families, and these are very important to a lot of our hospitals and health systems. The more we can tap into these younger families, we have, these relationships for life as we carry through with them, becomes important. So understanding how they're getting information, how they're making or getting recommendations and referrals is important. Alternatives to traditional hospital care, so freestanding specialty care centers, convenience, comfort, cost savings, I think are all very important to them. There are places that are convenient and cheaper and easier. And again, I keep mentioning, once we get into these trends a bit more, you'll hear me speak significantly about this sort of rise in retail medicine And that goes to my next point. Going to the hospital is no longer the only option for treatment. There's been a significant rise in digital competitors and in-home delivery, but also bricks and mortar places like CVS, Walgreens are really accelerating their delivery of services. And they have increased financial responsibility, especially during an economic downturn. They, are going to be making decisions based on what their perceived value is or what those out-of-pocket costs are. So, okay, so with that in mind, just thought it would be good to get us on the same page, at least with what we see as sort of the broader themes, the broader trends, and who this new healthcare consumer is. So, as I mentioned, we have 7 of our trends this year in our 2022 Marketing and Healthcare Trends Report. So trend number 1, addressing that burnout head on. And we mean this about internally within your organization. As I mentioned before, your employees were heroes. They were very much heralded for the hard work, the difficult work that they were doing. They were asked to be away from their families longer and more than they ever had been, and also being put into, sort of harm's way, as it were. So in the process of not only being heroes, they were also martyrs. Many of them, became sick, and unfortunately, some of them died based on, where they were on those front lines. That is going to aggravate the chronic issues we've had with retention and maybe even recruitment. We see that as, that's been an underlying problem, perhaps, and I was hoping that I was wrong early on in the pandemic. I thought, well, this is going to be great. The frontline healthcare workers are really being held in very high regard. They were being thought of as heroes. And perhaps that'll create an attraction to a field, especially at a time when people are getting kicked to the curb by other professions. Retail, restaurants, travel, and tourism, really shut down quickly. But these essential jobs that the public was very proud of, I thought for sure this would be the end of, or at least help, the retention and recruitment issues. But I think the burnout is visible to a lot of people in the public. So as a result, it may be aggravating those. And in some of our research, we noticed that women, in particular, those without family or mothers with young children, may be very susceptible to burnout in particular. So what can you do to help? Certainly addressing those systemic failures, looking within the organization at your processes and systems and realizing, where does that burnout come from? It could be staffing. We could be mandated to work longer in second shifts. But a lot of the research that we've seen and read and some of our own direct observations really speak to the healthcare providers saying, I'm burnt out because I have way too many bureaucratic tasks. Skipping ahead a bullet, maybe you want to conduct a technology audit. Maybe you want to look at those, internal systems and processes and look for ways that you can streamline and create efficiencies. A, I think it'll help address the burnout issue, but B, the staff would be very grateful for those kind of efforts. I think engaging staff to really listen, this could come out of HR, could be within public relations, teams or whatever, but really forming sort of those or tapping into those committees or groups that can just speak to, the overall sort of morale, if it were. And certainly, and many of you have seen us talk about this before, promoting those self-care programs and benefits packages that can help. Anything that could help the staff, whether they're health and fitness and wellness, nutrition, meditation rooms that you could have, massage services that could come in, any of those type of things, certainly lets the staff know that you understand the issues they're facing, that you're actually taking tangible steps. But why not share those out with the public also, just so that the public sees that the people that are in the business of caring care about the people that are in the business of caring, as it were. So trend number 2, the morality of inequality. And I mentioned this at the beginning of the presentation. If you look at those COVID infection rates, we saw significant spikes in communities that were typically underserved, communities that had lower education and income levels, really unfortunately got hit harder throughout. Add to that over the last year, a number of social issues, it really pointed to something that we thought was important to highlight as one of our trends here. And this is certainly something our team had authored and understands that racial inequality is a public health issue. But a shout out to my daughter, Chloe, who I think is watching this live. She's a public health major at Columbia, and she, is famous for preaching that dad racism is a public health issue. And so I think with that in mind, and the more that we recognize it, the more I think that we can, deal with it head on. I mentioned the COVID raids a minute ago, and we see this not necessarily as an opportunity for you to do better, to think differently, to better serve the communities that you're engaging with, but really it's an obligation. I think we have a duty to understand where those imbalances are, understand deeply the communities that are being affected and what are those core systemic issues, how we can get in. The public certainly has had enough. They're demanding accountability from healthcare leaders, from their elected officials, but they're also demanding increased accessibility. Now that can take the form of telemedicine or, bricks and mortar. And so one of the little call outs from our report really asks the question whether underserved communities know you, and how do you rebuild and how do you build trust with these groups by adopting programs that recognize those needs, making healthcare accessible for all. And I think I do have that on the next slide. Encouraging you to reach out and reach further within your organizations. For those of you that have community advisory boards, keep it up. Ask the difficult questions, challenge them to give you difficult or straight, candid and frank answers. And if you don't have those, understand or consider developing a community advisory board, getting those opinion leaders in the room, people that represent the communities, that look at their different regions, that represent different minority groups, underserved groups, whether it's even geographic, is really essential. And with that in mind, and going back to the accessibility, I think there's an opportunity and again, an obligation for us to invest in, or if you have them, expanding either mobile health clinics or sort of pop-ups that happen in different places. Again, now consumers are being sensitive to the fact that we can do pop-up COVID testing. We can do pop-up COVID testing before I can bring my child to college or get into the dorms. But we can do pop-up COVID vaccination, and we've shown that we can deploy healthcare services pretty quickly. So why not be able to deliver those in other areas? And why not house calls? I know it sounds kind of crazy, but it's not kind of crazy. And you'll hear me talk about that, I think, in the next or one of the upcoming trends. If the public needs access and has difficulty getting access, again, we have an obligation to be able to meet their needs where they are. This is not something that's reserved for the rural healthcare delivery models, where you've got the physician with the black bag driving out in the Model T to make a house call, but really, programs that we should be embracing and considering at the local level, because the competition already is, and you'll hear me talk about this. Recruitment strategies. I think it's essential that your workforce mirror your community. Look at it, think about it, and measure it. Talk about it. Even considering new positions. If you're a large enough organization that you can have a dedicated chief diversity officer, or at least having somebody that's qualified to be able to speak to and work with those issues, I think is extremely important. And finally, investing in training for organization leadership, getting them more sensitive to those issues, understanding what the opportunities are for them and their organization moving forward. So telehealth has grown up, is glowing upward. The glow up of telehealth is trend number 3. So we mentioned this briefly in 21. This was a 2021 trend that we spoke about briefly, but then we talked about how we personalize triage. We talked in the past about relationship building through telehealth, automation, or whatever. Now, with that in mind, and knowing that really kind of got its momentum throughout the course of the last year, we're encouraging you to maintain that momentum and expand it. How can you then take this deeper into education? How can you take this deeper into support groups or coaching sessions? Again, even going back to our previous trend, this helps you improve access, especially if you understand, if you're listening to the needs of the community, of particular underserved communities, understanding what those needs and wants are and delivering them through telehealth, I think would be, critical. And thank you. Just jumping back, I'm catching up on one of the comments, somebody mentioning that I think the calls with their nurses going into homes regularly. So I'm glad you guys are seeing that also, just sort of backing up and commenting on that late. So on the next slide, get the technology right. It's been 18 months. We've had 18 months to do this. No more freezes, bad framing, bad lighting. If you could see the rig I've got here today in a completely empty house, to be honest, and maybe I'll post this on social media, I propped my laptop up on a 12-pack of Gatorade just so it was oriented a little bit. I think those little subtle differences of framing, good bandwidth, good lighting, a decent background is critical. And I'll bring this back to my first bullet. We often, and many of you that have known us over the years have heard us describe this sort of airline tray table analogy and how it relates to healthcare. So what I mention is, if you're a passenger on a flight and you're finally in the air at 30,000 feet, and many of you are nervous flyers, so it's time for a snack and you take the tray table down in front of you and it's dirty or it's kind of loose, needs some bolts that need to be tightened. As a passenger, we can't help but think, well, that's a pretty easy thing to maintain. It's a tray table. You just wipe it down after each flight, tighten up a screw. But that's a simple thing. And if you can't get the simple things right, now I'm worried about the more complex things like the engines. And I don't want to think about that at 30,000 feet, to be honest. Many of you would have heard us talk about that. And I think, often we compare it to the first impressions, your external landscaping, the hallways, overflowing garbage cans, those kind of things. But I think it's now important to extend this into the technology. Audit your presentations that are happening from different service lines or different physicians. It's important to understand how those things look, what the technology is, the lighting, the background, because it creates that initial impression. And if it comes across well, then their confidence will start there and you only can move, forward with that. So, and again, promoting those technology and promoting your telehealth on web and social media, email, patient navigators, all of those kind of things. The more that you're using and talking about it, I think it's important to consumers. They need to know that you're ready to embrace it in whatever form it is. So, as you're embracing telehealth more, promoting it more, I think is essential. So this rise in healthcare consumerism is trend number 4. And we've talked about this early on in terms of at least how consumers are thinking, how they're making decisions and information. But again, I think the competition is fierce and very often unrecognizable. And this is what I meant before when I was quoting Rahm Emanuel saying, never let a good crisis go to waste. I think there were a number of different meanings here, but what we've seen over the last 18 months has helped, to my previous trend, really push telemedicine aggressively. It's really helped it find its place and really helped it mature much faster than I think it would have otherwise. Retail pharmacy based, I think, will still be there. Many of us are familiar with that. We knew that was coming. We saw the moves that CVS was going to be making to deliver more primary healthcare services. On-demand telehealth from digital partners around the country. We've seen sort of login mental health advocates, apps that have one-to-one interaction with those. But this last one, Amazon Care, if there's anything that should be really scaring the hell out of all of us that are delivering things traditionally, hospitals, health systems, independent clinics, it's Amazon Care. Take some time after this presentation, Google Amazon Care and watch the video. It's remarkable. It starts out, knowing first off that we know what kind of infrastructure Amazon has. It starts off pretty predictably that there's going to be the ability to use an app, to take a picture, to engage with somebody, text, call, etc. The really interesting thing for me came toward the end of the commercial, where now after the digital interaction of symptoms, then the physician or the face of Amazon Care said, you know what, I'm going to send a healthcare technician out to your house. And, you know, with a nice backpack and a professional outfit, up the stairs of, you know, someone's front door comes a healthcare professional. And that's what I find truly remarkable. Certainly, Amazon has the infrastructure to deploy people. Now, deploying them literally into house calls is remarkable. You know, this is a point, you know, of contact, the amount of people that are engaged in Amazon. And if you thought this idea, this notion of delivering house calls was kind of crazy earlier, and I'm glad some of you don't because you put those comments in the chat. You know, we see Amazon Care being one of the most significant disruptors to the traditional ways we've been delivering healthcare than ever before. If there's one thing, I'm sorry, the purpose of this is so that you can sleep, these trends report is so you can sleep better at night. But if there's something that you should be worrying about more and more over the next year or two, I think it's this. But you have the local advantage. You know, very often, many of these online services that I've been talking about are very generic. They have stock images, or at the very best, they have cliche images of somebody photoshopped in front of your state capitol or some local landmark or whatever. But you really have that genuine local authority. And if you're engaging and you're listening to your community, you understand the community-based programming, you understand their needs and wants, you're sponsoring local organizations, you're partnering with local organizations, and you have deeper traditional relationships. Now, that said, to the second last bullet, we still think you should be investing in digital relationships now. You know, whether it's an enhanced presence on social media, your email marketing, your CRM systems, and embracing telemedicine and investing more in telemedicine. The more time you're spending connecting with those digital relationships and building those now, we think it's going to pay off later. Either that you're going to be able to diagnose them and send somebody out for a house call now, as you're delivering those things in the future. And why not, before I move to that last bullet, why not take a page out of Amazon's Care book and develop a pilot project? Why not say, hey, listen, we want to test a particular service line. We want to be able to do a test project. We can engage folks electronically. We can have all the systems in place to communicate. And if it needs, you know, somebody that's a healthcare provider that can come in, you know, depending on the acuity of the situation, obviously you'll dial 911 if there's something that's particularly acute, but you know, why not try a test project like this? Not only to see how it goes, what you need to learn and do moving forward, but also how does your community react to it? Not every community is going to react the same way to these different things. And then promote the hell out of it. Hey, we're trying, you know, this program. What do you think? You know, even just putting out a test project and showing a picture of somebody in your community walking up the steps of a neighbor's home to help deliver, you know, as a follow-up to telemedicine, in-person delivery, you know, promoting that, I think, on social media where you can learn and listen, but also through public relations and everything else would be quite remarkable. And I think it'll give you a good sense of direction on, you know, what the community's interest is in those types of services. So bring all that content that we described, all this up to this point online, you know, your social media, your email, your newsletters, because people are consuming digital content more than ever before. So trend number 5 of 7, the fear factor. Again, you know, patients are off balance for a number of different reasons, a number of different issues, and now it seems to be the Delta variant. And so many people traditionally avoid the hospital. They still avoid the hospital, but more so now. And so I think we need to make patients feel safe again. I want to make sure, although we all knew that we were showing pictures of people with PPE and maybe we have some temperature screenings as we come through, I think it's important, you know, we may feel like we already told that story, but as, you know, things flare up at different levels in different communities, show your precautions. I think it's really important that we tell that story, you know, as often as we can in the coming weeks and months, especially as we get into cold and flu season, or maybe we're going to call it COVID and flu season. You know, certainly an opportunity, I think, to celebrate heroes that are in operations and maintenance. Hey, a shout out to the folks that are just helping keep this place clean, that are helping to deploy these systems, that are screening people, you know, your folks that are on the front lines before they even get into the clinical care. Talk tech. tell them about the temperature screenings, tell them about the percentages, tell them about the technologies, tell them again about telemedicine. And this third bullet, those check-in procedures that you have, think of it the same way that the public did with TSA. Again, can't help myself but post 9/11 thinking about, how did we all react? What were the societal changes to 9/11? In this case, increased screening and check-in procedures for airlines. But this is all happening during and post-COVID. And I think the public certainly felt a lot more comfortable to fly after we had the types of screening procedures that we did, and we worked the kinks out on all of those. That was a very visible thing, not only that the public learned about, but the public saw and was engaging in before they would travel. I think there's an opportunity for us to take a page out of their book and do the same, show our check-in procedures and promote that. I don't often recommend to clients that they brag about their infection scores and the rates. Typically, that's something we might want to talk about as our messaging in response to maybe like a C. diff outbreak or something else that might be happening at a local level. But really, those are metrics that are measured. They're measured by third-party providers, whether it's departments of health or Leapfrog or whoever else you're looking, sharing your data with. But it's a good indicator, for the community that, hey, we rank #1 in the state for whatever, infection scores, in-hospital infections, whatever it could be. And I think another thing that'll bring comfort to consumers that are leery and weary would just be simplified communication and instructions. Let's not forget that the healthcare system itself is extremely complicated, and more so now that we've got to try to figure out when we can go, where we can't go, telemedicine, check in, how do I check in, and everything else. People are extremely off balance, but the more we can simplify communication and instructions, infographics, primary colors, simplified 1, 2, 3 steps. It's a lot of the time the reason that people just love the patient navigators that help them through, for instance, cancer treatment. There's somebody there that's there to help guide you, almost a concierge that can just help relieve all of that confusion and clutter. We can't obviously deploy those people for every instance, but the more we can simplify communication and instructions, giving them simple sheets that we can hand out that, here's your 3-step process. We can't, do that too often, in my opinion. So trend number 6, creating first-party data. So first, what is first-party data? And I think I talk about this. All right, so there are a lot of significant changes that have happened in the last few weeks and months with regard to the data that Google and Apple are sharing, not only with their app developers, with marketers, cookies that Google is no longer enabling. And that's only going to increase. I think they're going to want to keep their data proprietary. They're going to want to have it for their own benefits. They may not be as open source as we would like. And so the point that our team makes in this is, and I like the sentiment in the second bullet, the only data that you can rely on is your own. So first party data by definition is the data that you collect on your audience, your public, your patients based on their behaviors. And that's with regard to your website, with regard to your enterprise software, with regard to an app that you might have, your social media, anywhere that you can find that data, it's essential that you harvest that and harness that. I think if there are investments that I would want to see organizations make in 22 that they didn't in 21 or 20, it would be in those sort of data areas. Do you need a dedicated person in IT that can start to create better lists? What's the enterprise system that you've got, whether you're on Epic or whatever else it is, or CRM systems like Salesforce, if you're lucky enough to have some of those marketing-based tools. Those are going to be essential. We're not going to be able to rely as much on Google, Apple, other third-party providers to be able to give us information about consumers. But if I know that this patient comes in every so often for something, if I know what articles they're clicking on in the newsletter I'm sharing, if I know what they're commenting on social media, all of this can be aggregated into enterprise systems, or certainly CRM systems like Salesforce and Salesforce Health Cloud. All of that, I think, is going to be essential for us to make investments in the coming year. I think it's extremely important. So audit your CRM systems, audit your data storage. Get people registering, get people to either create or expand reward programs that you might be creating. You might reward people and they can earn certain points for different types of behavior, whether it's wellness or screenings, and that might help you partner up with a gym membership discount or something. Add lead generation forms to your website, push social media to the web. All of that you can do will help you build more of that first party data that you're going to need to rely on in the coming weeks and months. Okay, so trend number 7, our last trend before a couple wrap up thoughts. And I mentioned this before at the beginning, I think, all of this comes down to a matter of trust. As I mentioned, it's not over. Many of us invested a lot in brands over the last year or before, sort of building compassion, highlighting, the messages from the heart rather than from the head. It's not over. People are still nervous. They're embracing new technologies. They're worried about Delta. We think you should double down on developing trust. It doesn't mean that you're not out there promoting service lines, but understand that they have some issues, they have some concerns, they're still nervous. Carve out some resources in your coming year to just put out those types of messages. Let them know why they don't need to be nervous. A, we understand your community. B, we have these new technologies to make it more accessible or to make you more comfortable. And if you are coming here in person, here's what we're doing to try to keep you as safe as possible. Listen to the community, identify those needs. Create a community beyond just the bed, what you can do and how you can help understand their, the wellness programs that you can deploy. Many of us already do these, but the mental health issues, I think, have become a huge challenge over the last year as all of us were forced into isolation. We were, taking a hit in income in our households. We were sick. We were afraid of getting sick. A lot of that's affected our mental health. And I think many of you heard us and tuned in to our 21 Trends report where we talked about that. Understand that community, you can create a community around mental health and providing those services, or at least providing tips and information. Get social. I think social media platforms are perfect for a lot of what we're talking about here. Help them peek behind the walls to see what you're doing. Highlight the stories that, show your staff going the extra mile to help build trust. Celebrate the staff, again, even not just the frontline healthcare clinical folks, but this is a great opportunity to celebrate, folks that are in maintenance and operations that are building out and making sure that, our facilities are what they should be. Our colleague Leanne often talks about story mining. Get out of your offices and the marketing and PR conference rooms into the different departments and just listen. Hey, what's going on? What's a moment you guys are proud of over the last few weeks? I think you'll learn a lot about some of the trends that are happening, but B, you may even, start to hear and learn about some things that are really worth highlighting and celebrating on that. So, and be visible. I say this often, and many of you have heard me say this on the crisis PR webinars that we've given. Voids are filled with negative assumptions. If you don't say anything, people will assume whatever the negative option is about that. Keep the essential services top of mind, but invest in building brands, not just the what, but the why. This is a huge opportunity for you to tell the public why you do what you do. Why did you go into business, for this? Why did you build your career in healthcare? Were you the type of person that was, doing teddy bear clinics, as a child, and that's just part of your caring DNA? That's what the community wants to hear and feel. That's what they want to know, that you're there to deliver. So lead with that empathetic content, email marketing, social media, blogs, all of that, is content rich. It's truly helpful. It's informative. It's that we've got you covered content that we know people want. And I think that will help you build and rebuild trust, or at least maintain the trust that you've got. So in conclusion, I hope you're able to see your practice, to see your organization through consumers' eyes. We know that there are a lot of changes that are happening. We know that we no longer have the luxury of captivated audiences, based on physician referrals, and that's how our entire business model has happened. Consumers have changed the rules. These digital, non-traditional providers are going to be very, very disruptive. And so hopefully these 7 tips have helped you kind of think about some of the issues moving forward, some of the trends and themes that we see. And as you're looking to build out those, I said this at the beginning, the skill sets, the budgets, the resources, the technologies that you think you're going to need. This is part of the reason we deliver this in September, is that we know that budget season's coming. People want to know what they should be staffing for, what types of skill sets, what type of training, what type of projects should we be putting into our marketing plans for the coming year. And if you want a good measure of your brand in the consumer's eyes, go to a review site like Google, type in your organization's name and see how many stars you're getting, see what kind of comments you're getting. And if you're not tuned into this changing consumer model, or you don't like what you're seeing, it may be time to seek professional help, as they say, and I'd be happy to be a resource for that. So thank you. Thank you for tuning in. On behalf, again, of our authors, Lisa, Katie, and myself, really want to thank you for everybody that was watching today live on Zoom. For those of you that are watching this on social media, like I said, I think we're streaming this on YouTube and Facebook and LinkedIn. All the comments that we weren't able to respond to in real time there, we will certainly share and respond to offline. And if there's no other sort of a last call for questions or comments here for the folks that are on Zoom, I'll thank you again. This presentation is available and it's being recorded, so you can share this in the coming weeks and months. We'll make and have made the presentation available on demand to download our actual written trends report. It's a brief, 10, 12-page document that we've hit the highlights from here. So again, thank you everybody for joining us. We really hope that this has been helpful, that this has been informative, and this will be a resource that you can draw from in the coming weeks and months. And if we can help answer questions or learn more about what's keeping you up at night, we hope you'll reach out. So thanks again for joining us. Thanks again, Katie, for helping to produce this event. And we'll see you as we go into the series. Throughout the fall, we're going to take a deeper dive on each of these 7 trends. So if there's one in particular that you find of interest, keep an eye out for emails from us. We'll take a deeper dive into each of those. So thanks again for being with us. We're glad you're here, and enjoy the rest of your day.